Hey everyone, Dr. B here. Thanks for tuning in. Wanted to talk to you guys today about how to go about finding a rehab center that works for you and your family, and also clarify some of the little known secrets about the industry and what to look out for when you're doing your research, because you're going to be spending a lot of time and money on this process, and you want to make sure you're doing it right. Just to let you know, I've had a lot of experience working at a bunch of different facilities over the past 15 years. To give you an idea, I've worked at places that cost $30,000 a month, all the way up to places that cost $100,000 a week. And there's a full spectrum in between there. And so, I have a lot of insight I want to share with you about how to go about spending your time and money in the best way possible. First of all, a lot of these places advertise, that they're very individualized programs, which is not always the case. A lot of these programs are really one size fits all, and a lot of them use 12-step approach and philosophy as their core approach to treatment, which is not a bad thing, but it's not the best fit for everyone. And so you really want to make sure, kind of what the program's philosophy is and how it all is structured, first of all, and how that fits with your own belief systems about what you need to get healthy and well. One of the biggest things or the biggest surprises I noticed when I was working at a lot of these places was the fact that there's very little individualized therapy in a lot of these programs, which I couldn't believe at first. Here you're paying, again, $30, $40, $50, $80,000 a month for care, and you're getting hardly any individual therapy work. How is that possible? Again, depending on the philosophy of these programs, a lot of them, take a 12-step approach, which involves a lot of small group work, as well as educational groups, educational seminars that go over all sorts of topics from relapse recovery to, addiction maintenance and all sorts of educational topics that don't necessarily get to how to handle and recover from addiction, just give you a lot of information about addiction in general, which would be the equivalent of, let's say, taking a depressed person and telling them how depression works and what they should be doing and how to be happy without necessarily giving you the skills and tools to do so or understanding why. There are programs that do offer individual work. So when you're researching these programs, you really want to make sure to talk to the admissions people and find out exactly how many individualized therapy sessions you're getting a week, number one, but also who are administering those individual therapy sessions. The second biggest surprise I found when working at a lot of these facilities were that a lot of the counselors that work there are not even licensed therapists, which I know sounds pretty crazy and shocking to believe if you're paying, again, $50,000, $60,000, $70,000 a month. But you would be surprised how a lot of these places have marriage and family therapist trainees or social worker trainees, which means that these people are still in graduate school or they're getting their hours to be licensed, and they're being supervised by licensed professionals, but they themselves are not licensed professionals yet. So you really, again, researching these programs, you want to make sure to ask, who's administering the care? Are they licensed psychologists? Are they licensed marriage and family therapists? Or licensed social workers are the ones you really want to ask about. Again, many of these programs have addiction counselors or addiction certificates, which is really not a lot of formal education. It's really just kind of going through a certificate program for a year or two. And doesn't really qualify a person to work with mental health related issues. You'll find that most of the people that work in a lot of these facilities are themselves in recovery from drug and alcohol addiction, which is, I guess, a good thing because they can relate to what you're going through, but at the same time, it doesn't necessarily qualify them to be able to administer care and help with psychological issues that often accompany addiction. So again, just make sure you're really doing your research to find out who are the people who are administering the services that you're going to be receiving. The other thing, a lot of these programs are really group oriented. There's nothing bad with group therapy work. A lot of powerful progress and insights can come from doing group work. However, you want to find out what the groups really consist of. Many of the groups are, again, kind of educational groups, or kind of even just seminars where they're like teaching you about the 12-step philosophy, or how to work the 12 steps, or relapse prevention, and not really what we call psychodynamic groups. Psychodynamic groups are groups that really look at how you function in a group environment. So whether you're interacting with your family at home, or with friends, or your colleagues at work, you're always kind of displaying certain personality traits or characteristics, or things that you're usually not aware of that you do. But when you do them in a psychodynamic group, both your group mates as well as a counselor can really help bring attention and awareness to those characteristics, and really create insight around what you're doing, why you do what you do, and a lot of times the conflicts that develop in groups can really, if properly resolved and worked through, can create incredible amounts of insight and really change, for how you function in the world. So you really want to check and see, because so many places do have a lot of groups as part of their program, but you really want to make sure that they're psychodynamic groups or process-oriented groups, again, being led by licensed professionals. Finally, the last thing you want to check when researching programs is, are they dual diagnosis programs, which means do they treat both the addiction as well as underlying issues such as depression, anxiety, trauma, because the vast majority of the time there's usually some other mental health related issue that's going on besides the drug or alcohol addiction. Especially trauma work. You really want to make sure whatever program you're looking into addresses trauma, because again, pretty much everyone is dealing with some form of trauma in their past, especially with addiction. And so if you're not really getting to the root of the underlying issue that's causing the person to drink or use drugs in the first place, then you're really just, addressing the symptoms and not the underlying cause. So make sure the program has, again, licensed psychologists, marriage and family therapists, or any therapist, licensed professionals who can treat dual diagnosis and trauma work. All right, thanks for tuning in, guys, and take care. All the best.